Good morning. My title is a retrospective case series analysis of clinical features and therapeutic outcomes in rhino-orbitocerebral mucormycosis in a tertiary care center. Introduction: mucormycosis is a rare opportunistic fungal infection that mainly affects diabetic and immunocompromised patients. It reached epidemic proportion during India's second wave of COVID-19, so with several risk factors. The management includes control of metabolic abnormality, administration of systemic antifungals, and surgical debridement that range from simple sinus clearance, radical debridement, and orbital accentration. We analyzed the clinical records of 17 patients admitted with the rhino-orbitocerebral mucormycosis during COVID-19 pandemic at our institution. The objective was to evaluate the clinical features, imaging characteristics with extent of disease and therapeutic outcomes in rhino-orbitocerebral mucormycosis. Materials and methods is a retrospective case series study of 17 patients admitted with radiologically and histopathologically confirmed cases in Government Medical College, Kottayam from January 2021 to April 22. Case where etiology couldn't be confirmed by microbiology or histopathology. Records with incomplete data were excluded from the study. Data regarding clinical presentations, imaging, therapeutic interventions, and outcome at discharge were collected from the records. So, for the purpose of analysis, the mucormycosis was classified based on the site of involvement into 3 groups. Clinical stage 1 includes sinonasal disease, clinical stage 2 include rhino-orbital disease, and clinical stage 3 include rhino-orbitocerebral disease. And according to treatment given, they are classified into 3 groups. Treatment group A includes sinonasal debridement with plus IV liposomal amphotericin B, and treatment group B includes treatment group A plus local amphotericin B injection, that is 1 ml of 3.5 mg per ml for 14 days. Treatment group C includes treatment group B plus accentration or intracranial surgeries. Based on the outcomes, people are divided into 3 groups. Group 1 is improvement with recovery, group 2 is improvement with sequelae, group 3 is progressive disease with complications. So results are, out of 17 patients, the mean age is 59.4 with a male preponderance of 71%. The common signs and symptoms include, the symptoms are most commonly the facial pain and swelling, followed by nasal discharge and defective vision, and headache and diplopia. The signs include nasal and palatal crusting, necrosis of turbinates, proptosis, conjunctival chemosis, ptosis, and CRIO, and CNS signs are altered mental functions, cavernous sinus thrombosis, and hemiplegia. The clinical stages, there are 5 patients included in clinical stage 1 and 2, and 7 patients included in clinical stage 3. Disposing conditions, all patients had uncontrolled diabetes mellitus with underlying disease. The 10 patients had a history of recent COVID-19 infection, out of which 7 patients received systemic steroids. Patient in treatment group B and C had more several metabolic derangement, with some patients having more than 1 underlying diseases. So diagnosis is the evidence of maxillary and ethmoidal sinuses present in all patients, and the features of preseptal edema, proptosis, middle thickening, orbital wall erosions, and minimal obliteration of fat shadow is seen in all patients, and intracranial disease on CT included cerebral infarcts, basal ganglia, and cavernous sinus thrombosis meningitis. The medical treatment given, all patients received intravenous liposomal amphotericin B for a cumulative dose of 3 to 5 gram as soon as the diagnosis of mucor was established. Local amphotericin B, it is 1 ml of 3.5 mg per ml for 14 days into the orbit, was administered in 12 patients in clinical stage 2 and 3. Surgical treatment includes all 17 patients underwent debridement of all necrotic tissue in the sinuses and the nasal cavity. 9 of 17 patients with a rhino-orbital disease underwent sinus debridement along with the local amphotericin B into orbit. The remaining 3 patients in the clinical stage 3 disease underwent orbital accentration with extensive sinus debridement. So treatment group A includes 5 patients, and B includes 9 patients, and C includes 3 patients. The outcomes, the patient underwent treatment A had a successful outcome 100%, and 5 patients with a rhino-orbital disease and 4 patients with a rhino-orbital cerebral disease underwent treatment group B, and the disease improved with sequelae like defective vision, loss of vision, diplopia, ptosis for 6 patients. 3 patients with a rhino-orbital cerebral disease underwent treatment C with treatment success in 2 of 3 patients. And the 3 patients in treatment group B with rhino-orbital cerebral disease and 1 patient in treatment group C died due to uncontrolled disease. The mortality was 23.5%. 6 patients treated with no perception of light. The 5 patients had improvement with recovery. 8 patients had improvement with sequelae, and disease is progressive with complication, and death occurred in 4 patients. So discussion, rhino-orbitocerebral mucormycosis is aggressive fungal opportunistic infection in immunocompromised and patients. The COVID-19 pandemic has a widespread sociological and economic disturbances, severely restricting adequate access to healthcare. This has caused decompensation of previously well-controlled comorbidities, patients with chronic illness like diabetes and CKD. We present a case series study of rhino-orbital mucormycosis presence during the ongoing COVID-19 pandemic era. This makes novel. Ours is a multi-specialty government hospital, was a dedicated COVID-19 facility. Patients were seen as a team of departments and coordinate with each other at every level of patient management. Intravenous liposomal amphotericin B is a drug of choice for mucormycosis. In our series, it was administered to all patients. Direct infiltration of the drug into orbit helps in higher level of drug reaching the affected areas. Treatment outcome is good when the disease is anatomically confined to sinuses. In this series, treatment success was 100% in that cases. Infiltration of amphotericin B into orbit and surrounding sinus is beneficial in these patients. In all cases, sinus and palatal disease debridement should be done whenever possible. This would help in reducing the load of infection in the sinuses and also obtain tissues for histopathologic diagnosis. The argument of radical debridement of all affected tissues in a patient with a mucormycosis is based on the capacity of the fungus to spread along the walls of the lumen of blood vessels, leading to necrotizing arteriitis, ischemic necrosis of the involved tissue. The result is poor penetration of systematically administered drugs. All the patients with the mucormycosis stage 3 did not do well. All patients in this group at presentations had intracranial diseases, which is associated with poor prognosis. A surgical clearance of all infected tissue, including extendation, is mandatory. Extendation should be prescribed in advance involvement of orbit. So, conclusion, COVID-19 patients, particularly those with uncontrolled diabetes mellitus who are immunocompromised or severely ill, have a higher probability of suffering from invasive fungal infection. Poor metabolic control and impaired renal function were the most common risk factors associated with the mucormycosis. Awareness of red flag symptoms and signs, high index of clinical suspicion, prompt diagnosis with timely initiation of specific treatment, aggressive surgical debridement depending on the extent of involvement, and this is the final outcome. These are my references. Thank you.
How many patients were on systemic steroids?
7 patients.
After your total number was how much? 17.
17.
Of that, 7 were
7
on systemic steroids. And how was the diagnosis of muco confirmed?
By clinically, histopathologically confirmed. All cases are histopathologically confirmed.
So even that sinus one biopsy proven.
Yes, all biopsy proven.
How many had accentration?
3 patients, ma'am.
The total accentration or subtotal?
3 patients.
Was it a total accentration or a subtotal?
Total accentration.
One died.
One died.